This video is going to teach you how to transition a patient from a continuous enteral infusion to bolus feeds. You'll learn how to do the calculations, and you'll learn when it is and isn't appropriate to make this change. Jasmine is a 43-year-old female who presented to the hospital with lethargy, slurred speech, and a left-sided facial droop. She underwent a hemicraniectomy for a large stroke on hospital day 2 and was started on a continuous enteral infusion on the day of surgery. After several days of failed attempts to wean her from the ventilator in the ICU, she underwent a tracheostomy placement and gastrostomy placement on hospital day 10. She was later transferred to a step-down unit where she was successfully weaned from the ventilator on hospital day 32, but remained on enteral feeds due to severe dysphagia. You're the registered dietitian on the step-down unit, and you receive a new consult to assist with the transition from the continuous enteral infusion to a bolus feeding regimen. You've been following the patient since she was transferred from the ICU and have kept her on a continuous infusion of Jevity 1.2 at 65 milliliters per hour with 175 milliliters of free water every 6 hours. This provides a maximum of 1,872 calories, 86 grams of protein, and just under 2 liters of fluid per day. At 58 kilograms, that's 32 calories per kilogram, 1.48 grams of protein per kilogram, and approximately 34 milliliters of fluid per kilogram per day. Jasmine has tolerated the continuous infusion well, has lost a total of 8 pounds over the past month, is awake but confused, and hasn't been cleared to ingest anything by mouth. To transition the patient to a bolus feeding regimen, the first thing you need to do is determine if bolus feeding is appropriate. In this particular case, I'd say yes, bolus feeding is appropriate. The patient is medically stable in the hospital, has no gastrointestinal issues, and doesn't have any changes to her anatomy and physiology that raise major concerns for intolerances. In addition to this, now that she has been weaned off the ventilator and her overall condition is improving, bolus feeding will give her freedom from the feeding pump, which will make it easier for her to participate in physical rehabilitation and other therapies. I generally avoid bolus feeding when patients are still in the ICU because their unique medical condition typically puts them at a higher risk of aspiration, and providing a large volume of formula only increases the risk even further. I also tend to avoid bolus feeding with recent or persistent vomiting and with diarrhea related to malabsorption, like when the patient has short bowel syndrome or a high output ostomy. Finally, I usually keep hospitalized patients on continuous or cyclic tube feeding when I see no obvious benefit of bolus feeding for the patient or nursing. In my experience, most patients who are bedbound and forced to sleep with the head of bed elevated don't prefer one feeding method over another, and most nurses prefer continuous and cyclic feeding because it requires less time and effort to maintain. As an aside, many clinicians view jejunal feeding as a contraindication to bolus feeding, but I've found it's worth trying if the patient is going to be active throughout the day. While some patients develop diarrhea from it, others tolerate it quite well, and the freedom between feeding sessions can significantly enhance their quality of life. After you determine that bolus feeding is appropriate, the next thing you need to do is reassess the formula and the energy, protein, and fluid load. If the formula still makes sense and the continuous regimen provides the appropriate amount of energy, protein, and fluid, then you're going to create your bolus feeding regimen directly from it. But if there are obvious issues, like the patient is on a specialty formula that's no longer indicated, or the energy or protein load is inadequate or excessive, then you may want to change it entirely. For our patient, I think the formula still makes sense, and the energy, protein, and fluid load require no significant adjustments. Jevity 1.2 is a standard polymeric formula that Jasmine has been tolerating well. She's lost some weight on the current regimen, but it wouldn't be considered excessive given the amount of muscle atrophy expected with her prolonged hospitalization. Looking at the amount of calories, protein, and fluid provided per kilogram, I feel confident that it will promote long-term weight maintenance and euhydration for someone who is 43 years old. If you're enjoying this video so far, make sure you hit the like button, share it with a friend, and shop for more free and exclusive content by clicking the link down in the video description. Now that we've decided that bolus feeding is appropriate, and that the formula and energy, protein, and fluid load don't need to be changed, we can begin the transition to a bolus regimen by identifying the volume of formula provided per day by the continuous infusion. To do this, you take the feeding rate and multiply it by 24 hours per day. So, for Jasmine, it would be 65 milliliters per hour times 24 hours per day, which comes to 1,560 milliliters per day. Next, you choose the number of feeding sessions for the bolus regimen. I recommend choosing anywhere between 3 and 6 feeding sessions per day. If you do less than 3 sessions, it will likely result in a bolus volume that's too high for the patient to tolerate. And if you do more than 6 sessions, then the sessions will have to be so close together that the patient will hardly have any time free from feeding. I find that 4 feeding sessions creates a nice balance between an appropriate volume per bolus and time between sessions. So that's where I start with most of my patients. Once you have decided on the total number of feeding sessions, you can calculate the volume of formula to give for each bolus. You do this by taking the total milliliters of formula provided per day and dividing it by the number of feeding sessions. For our example, it would be 1,560 milliliters per day divided by 4 feeding sessions per day. The result is 390 milliliters per bolus. From there, the next step is to select the volume and frequency of free water flushes. Ideally, you want the patient to get water flushes before and after each feeding session. This is because it helps to minimize the risk of contamination and the clogging or cracking of the tube from a buildup of formula residue. Since we decided to keep the 700 milliliters of free water per day from the continuous infusion, to get a volume for before and after each feeding session, we just divide it by 8. This comes out to 87.5 milliliters, which can be rounded up to 90 milliliters. That gives us a bolus feeding regimen of 390 milliliters of Jevity 1.2 4 times per day, with 90 milliliters of water flushed before and after each feeding session. Before you write a final prescription, you'll just want to check your work. 390 milliliters times 4 is 1,560 milliliters, and since it is a 1.2 calorie per milliliter formula, the calories provided are 1,872 calories per day. 90 milliliters times 8 is 720 milliliters, which is less than 1 ounce more than is provided by the continuous infusion. Together, the total volume of liquid administered at each feeding session is 570 milliliters, which is equivalent to 19 fluid ounces. This seems like it would be enough to prevent feelings of hunger and not enough to make her feel too full. If we had concerns about her ability to tolerate the volume at each feeding session, there are several precautions that we could take to reduce it. One option is to start at around 50% of the goal bolus volume and then slowly increase the volume each day to get a clear picture of what the patient can and cannot tolerate. Other options include increasing the number of feeding sessions to 5, switching to a more concentrated formula, or reducing the water flushes at each session and establishing a time for the patient to receive a bolus of water only. Keep in mind that there's no specific volume that requires you to make a change, and there are no rules that dictate which change is made. It's all about taking it on a case-by-case basis. At some point, you just have to go with your gut instinct and try something. Coming to the end, we can write a prescription. We recommend a switch from the continuous infusion of Jevity 1.2 at 65 milliliters per hour to a bolus feeding regimen of 390 milliliters of Jevity 1.2 4 times per day, with 90 milliliter water flushes before and after each feeding session. We can also assign specific feeding times for the nurses to follow. I like to space them out evenly, such as 7 a.m., 11 a.m., 3 p.m., and 7 p.m. The last 2 points I want to make are regarding the first bolus to be given and how to write a prescription using the number of canisters instead of the volume in milliliters. With the first bolus, you'll want to be careful about going straight into it from the goal rate of the continuous infusion. That's because the patient will already have some formula in their stomach, and adding a bunch more all at once may make them feel overly full. To avoid this predicament, I recommend creating a space between the end of the continuous infusion and the beginning of the first bolus. You can either hold the continuous infusion for 4 to 6 hours before the first bolus, or you can stop the continuous infusion at midnight on the first day of the bolus regimen. Then for writing a prescription using the number of canisters, you may want to figure out the individual volume of the canisters for the formula you're providing, and how many canisters are needed per day and per session. This is because it can be much easier for the nurses, the patient, or the patient's family to understand. Jevity 1.2 comes in canisters that are 237 milliliters each. At 1,560 milliliters of formula per day, Jasmine would need approximately 6.5 canisters per day. As you can see, this doesn't come out neatly when you divide it by 4 feeding sessions. Thus, you may want to change it to something like 1.75 canisters at 7 a.m., 11 a.m., and 3 p.m., and 1.25 canisters at 7 p.m., which puts the recommendation for formula in the simplest terms possible. Jasmine may not receive the exact number of milliliters recommended every time, but it should be close enough to satisfy the estimated nutritional needs. Thank you for watching. Don't forget to like the video and subscribe to the channel.